Oh, next is AERS, and Lauren is going to tell you all about that program.
Okay, I'm Lauren McAdams. I'm a social worker and the AERS administrator. So we're going to talk a little bit about adult evaluation and review services. So what is AERS? AERS is a state mandated program. So unlike some of the other programs you just heard about, we do have an AERS located in each county in Maryland. So I have counterparts that do similar things in each county. Our aim is to help county residents remain safe in their home by connecting them with services, recommending services and supports that can help them be happy and as independent as possible. AERS staff consists of registered nurses and social workers in each of the AERS counties. And then we also have a psychologist and a psychiatrist for consultation as needed on some of our assessments that we do. So what programs would you maybe need an AERS evaluation for? The first 4 programs are main programs. The Medicaid ones are the Community Personal Assistance Services, Community First Choice, people who are interested in getting on the medical daycare waiver, and the home and community-based options waiver. We also take referrals for Office on Aging programs. Those referrals come straight from them after their clients have been approved for their criteria, and then they just need us as a piece of the puzzle for those. And then we also do nursing facility placements for people who are living in a home or community setting and are interested in going into long-term care. And the last one there is PASRR, which many of you who work in nursing facilities or in hospitals should be familiar with. So PASRR evaluates an individual who is seeking placement in a nursing facility, who has a diagnosis of a mental illness, an intellectual disability, or both. So we evaluate also people who are currently in a nursing facility who would then screen positive for mental illness, disability, or both, or people who are in and have a significant change in their physical or mental condition. And then we would be given a referral by the nursing facility. A different piece of the PASRR is that we do a psychiatrist or a psychologist participate in that program.
So we can determine competency.
Not as part of our AERS assessment. It's a different thing that we're looking for. So it is a multidisciplinary review as part of PASRR, and we're looking to see if the nursing facility needs to provide anything for that person above what they usually would do. So just for those of you who may refer PASRRs to the health department, it's best if you work in a hospital to refer them to us as soon as possible. It is our longest assessment. It usually takes us on average about a week to complete, just because there are so many pieces to the puzzle with getting the multidisciplinary review. So if you have a patient that is being discharged, it's better to call us as soon as possible so we can get things rolling. So like I said, the referrals are generally coming from, are we missing a slide? Are generally coming from hospitals or nursing facilities. And we would get the screen from the referral source who has determined that that person is suspected of having a mental illness or an intellectual disability. Then we get the referral, we complete our own assessment, and what we're doing again is just to take into account their psychological, psychiatric, and functional needs and make sure that they're considered in their care plan moving forward in a nursing facility. PASRRs are pretty tricky, actually. We have been doing this for a while, but we still have lots of questions. The hospitals still have lots of questions for us. So if you're not sure about a screen when you're completing it, it's always recommended that you can call us and we will try to figure out the answer if we don't know it. Question?
Yeah, so do you guys help with discharge planning from like the inpatient psych stay?
We don't. The question is, do we help with discharge planning from an inpatient psych stay? No, we don't. We don't do a lot of things with inpatient psych, but we do have a very rare kind of assessment where someone's going into a state psychiatric facility where they may call on AERS to complete an assessment. So usually the AERS assessments that we get for PASRRs are people that are going to rehab for over 30 days, people are going to long-term care from a hospital. Okay, a little bit about our most popular assessments that we're getting for our Medicaid programs. So we have the first column is the community personal assistance services. That's kind of like the first step that people can qualify for if you have community medical assistance. It includes personal care, supports planning, and nurse monitoring, which we'll be learning a little bit about in a little bit. We also have the community first choice program. This is probably our most popular. It includes the personal care, the supports planning, and the nurse monitoring, plus some other popular services are the medical alarm, home delivered meals, an environmental assessment and adaptations, and the medical daycare. And then the last one, the community options waiver. We've kind of talked about this in some of our past training sessions. But the big thing to remember here is that assisted living is part of that program, so it makes it very demanded by some of our families because that's kind of what they're going after. But it also includes all the community first choice programs if they're not interested in assisted living. So what is our tool that we use? It's called the Inter-I assessment. You may have heard about it. It is a standardized international tool. It was developed by a team of clinicians, and it identifies the functional, medical, and social issues that are limiting to that person. It also tries to identify the unmet and unrecognized needs. These may be things like the person's pain, how is that controlled, any nutritional factors, fall risks, and risk for abuse and neglect. And in October, we began our pediatric form of the Inter-I. This is new to all AERS counties for individuals under 18 years old. So some people may think that we're just a geriatric service, but we are seeing more and more young people now, people who or children who have autism, who have behavioral issues, who have developmental delays, who have experienced significant trauma, abuse, and neglect. You can also make a referral to AERS and have them be assessed via the pediatric form of the Inter-I. So the Inter-I questionnaire asks a lot of questions of people. We want to know about their overall health history, their current medical conditions, their mood and mental health, who they have to support them or the lack of supports in their life, any environmental concerns that we have or they have about their current living situation, how much ADL assistance and IADL assistance they need, and where is that coming from? Are they having to do it by themselves, or is a family member helping them? And what the client is really concerned about and what their wishes are moving forward. So after we ask them all those questions and we put together our assessment, we will also put together a plan of care, and that's going to include our recommendations if they're approved for the program. So how would you make a referral? If you're interested in the Community First Choice program, you can just call our Division of Care Coordination phone number and just give me a little bit of information about the client's demographics and their medical assistance so I can look that up and make sure that they're eligible. Or you can also complete the referral to Kim Proud at the Care Coordination Plus, and she can then route it to AERS. If you need to make a PASRR referral, again, you can call the Division of Care Coordination. Let us know that you have completed the first screen and that it's positive. And just tell us a little bit about the client and what their discharge plan is looking like. And then we would ask that you fax that screen to us so that we can review it. So after you make a referral to AERS, a nurse or a social worker will be assigned to the case. They will call the client or the family member, the point of contact, to set up a visit. Our services are voluntary, so if a client is a little bit hesitant, we do try to educate them on the program, talk about things that we feel like maybe they would benefit from, but it is voluntary. And then after the evaluation happens for the Medicaid program, they would get a letter saying if they were eligible or not based on our assessment. And if they're eligible, they get that support planner, like that caseworker, that would then follow up with them. So we just do the assessments once they're enrolled in the program. We don't do any case management. We would just follow up yearly to recertify them. Any questions? Yes.
Does the patient have to sign consent?
So the question is, does the patient have to sign a consent? Once they're enrolled in the program, I believe they do sign a consent for services, and they do sign a HIPAA with us for privacy as part of the AERS. But for the assessment, the HIPAA privacy form is the only thing they have to sign.
And so I'll just give you an example because that's the best way for me to ask the question. I have a 71-year-old tomorrow that's supposed to have a valve replaced down at University of Maryland. She has no support at home. She makes under $1,000 a month from her Social Security. And she told me she'll lie to the people at University of Maryland to be able to go home alone. She'll tell them that she has someone in the home. Is it appropriate to ask her if she wants an AERS referral versus make an AERS referral? I mean, I've already talked to the case management department at University of Maryland, and we will work collaboratively, but
I would say that it really doesn't hurt to try. I hate for someone who may be receptive at that point in time, especially given if she has a change in her health status. Maybe once she gets home, she would be accepting of help. And I would hate to see that opportunity missed. So I would say to refer to the program, and then we'll just do our best to try to hear her needs and see if we can make it work with what she's looking for. And also we try to frame it as, the schedule of someone coming out to help you is based on what you're interested in. So if you are not a morning person, we're not going to send someone out at 7 a.m. to get you out of bed and get you ready for the day. So there's weekend hours available, there's evenings, there's mornings, so we never know. And if someone just wants a couple hours, and they've been approved for maybe more, we start where they want to go. So it's a very patient-centered program. So I would recommend referring it and see if we can change your mind.
And I have one last question. How would you handle, I have another patient that has dementia. How would that be different? Like right now, the neurologist told her, you really shouldn't drive. But she's like, I'm so mad, I can drive.
So it is tricky with people who have dementia. A lot of times the program, by putting those services into place, it does allow them to stay in their apartment and be safer. So sometimes that's a way to kind of get them to accept the help. It's a little harder for us to find out the information we need for the assessment if the person's not a good historian. So sometimes we'll get them to sign a release and try to get some information from the doctor that they're working with, or ask if we can speak with a family member, or ask if a family member can be present during the assessment to make sure we're getting the full picture.
Great, thank you.
Yep. Jan? Good. Okay. Emily?
person diagnosed with dementia, that's the only cognitive thing they have going on, would that qualify for a PASRR? Or they need to have another mental health diagnosis?
So for PASRs, dementia is not considered a mental illness. So we have had across the state, I think, a lot of people who have been referred to PASRR, and we've gone ahead and done the level 2 screen, and then it kind of comes back as it probably should have been negative all along. So for some cases where a lot of the behavior is, we believe, caused by the dementia, it kind of gets into a gray area. So if you have some questions, you can always call and say, we're seeing this dementia, but we're also seeing some of this other stuff, and we're not sure if that's attributed to the dementia or not. And we can talk to our behavioral health contact and see if we feel like we should go to the level 2 or recommend that it's a negative screen. Yep.
Could you give me an example of what would be an appropriate PASRR referral?
So someone who has a documented intellectual disability, that's what we see a lot. And for like the mental,
Home alone, or
say that again?
are they living home alone, or are they in a group home?
We do get some that are from a group home. That's fine, that they've just been hospitalized from that. And, you know, a lot of times when they're in group homes, their intellectual disability is well documented, so that kind of helps us. Some people, it is hard, older adults who have an intellectual disability but really don't have a lot of paperwork about it from their schooling to support that when they were much younger. They've lived with their parents their whole life, and those parents are now older adults. It's a little trickier for us to document it, but if somebody has an intellectual disability, it's best to just screen it positive and send it over to us, and then we do a little bit more like investigative work to find out if it's truly an intellectual disability and how that's been documented in the past.
I just feel like I don't understand what the program does. I'm sorry, I just don't get it.
So the PASRs are kind of like a completely different part of the program. It's a federal regulation, and really the aim of the PASRR is to make sure that somebody who's going to long-term care or to a rehab stay, and if they have a serious mental illness or if they have an intellectual disability, that we're just not putting them in there and not recognizing what services they may need. So we recommend, as part of our evaluation, do they need like a psychiatric consultation, and that person to then follow them throughout their stay? Do they need a special device to help them communicate? I just had an example that I saw. Do they need like a grief counselor, like something very specific that maybe the nursing facility typically doesn't offer? Most of the time, the person, we believe, would be fine in the nursing facility with what they have available. So we kind of just document what we feel is appropriate going forward. In other cases, if we feel like the person needs something, extra special because of that illness, then we just recommend that and send it over to the nursing facility. So it's just like a double check to make sure that people who are going into long-term care are not forgotten about.
Got it. Thank you.
Mm-hmm. Okay. Oh, yep.
So how does the park plan with the children under 18 as far as having a disability?
For the PASRR, or?
Yes.
I'm actually not sure. I haven't had any PASRs. Do you know, Mary Jo?
I think it's for adults.
Adults? Okay. Yeah, I haven't had any children.
Maybe someone that's, the family wants to place in long-term care, and we have to determine is that an appropriate placement with doing the PASRR.
Mm-hmm.
Can you repeat? We didn't hear that.
Sure. Sure. Can you say that again, Mary Jo?
They were asking about the age. I think it is for adults too, but sometimes a client, it may be a family that wants someone who has these developmental disabilities or a mental health diagnosis to go into long-term care. And then that PASRR needs to be done to determine is that an appropriate placement for that individual, because the whole goal is to keep people in the community as long as they're